Thank you. Welcome back to the Senate Finance Committee. Today is Tuesday, March 11th, and this is a voting session. We're going to start with Senate Bill 43, Senator Augustine's bill, and our analyst Nathan will begin.
So Senate Bill 43, as amended and shown in the reprint before you, requires the Department of Health to establish a forensic review board at each facility that has persons committed as not criminally responsible, which you may have heard of being referred to as NCR. The boards are responsible for reviewing and determining whether to recommend to the court that a committed person is eligible for discharge or conditional release with or without proposed conditions. So the amendments, starting on page 4, you'll see that the amendments strike provisions related to the codification of certain community forensic aftercare programs. The amendments then additionally establish new notice, representation, and other requirements related to the submission of statements to the board, further require a person's treatment team within the facility to implement any recommendations of the review board, and then finally the amendments would specifically authorize the newly established board to make recommendations related to the release of a committed person. I was describing the amendment, including striking the, most importantly, striking the community forensic aftercare program, which was the source of the fiscal impact in the bill as originally.
Do I have a motion for Senate Bill 43 as amended? Senator Hershey, you have a question.
Question, if you don't mind, Madam Chair, just to clarify your last statement, because there were fiscal notes that required new positions.
Yes.
Right. So is that what goes away, or did the program
In
go
the
away?
case of the Office of the Public Defender, the fiscal impact was related entirely to the community forensic aftercare program, and it was largely the case with the Department of Health. It wasn't as clear in the fiscal note that it was exclusively related to that, but MDH has said, after reviewing the amendments, that it would not, it wouldn't cost them anything.
Wouldn't cost them anything. Okay. Thank you very much. Thank you.
Did JPR pass it already? It's joint with JPR.
They're secondary, so no.
No, we pass it first and then they come behind us. Any other questions for Senate Bill 43? Can I have a motion for, as amended? Thank you. Senator Hayes, do I have a second? Do I have a second? Senator Mounts. All in favor of Senator Augustine's Senate Bill 43 as amended? Senator Hershey, unanimous? Unanimous vote, thank you.
Up next is Senate Bill 219. This is a departmental bill which, as amended, increases the additional assessment that the Board of the Uninsured Employers Fund may direct the Workers' Compensation Commission to impose on workers' compensation awards and settlements from 1% up to 1.5%. So the amendments decrease from 2% to up to 1.5% the additional assessment that may be collected. Further down in the amendments, you can see that the bill increases the fund balance that must be achieved before a certain part of the UEF assessment must be suspended, and then makes a corresponding change to when the assessment must resume. And then finally, on the hand-numbered page 3, the amendments require the Workers' Comp Commission to appoint a special monitor to report on the financial condition of UEF for a period of 1 year. There'll be a corresponding budget amendment related to fencing off a certain portion of UEF funds to pay for that monitor.
Senator Mounts?
Monitor's there for a year,
Yes,
So the,
and then we could extend that if we wanted to.
sure.
yes.
They're so close to being insolvent, we have to do something to get that turned around.
Yeah.
Senator Reedy?
So the assessment would go up, we're going 1.5, 1?
It's already 1, we're adding a half.
A half,
For a total of
okay.
1.5, correct?
When
yeah.
we are
That's
Sorry.
No, so I just want to clarify, there's two pieces to the assessment that UEF can currently assess. There's a 1% assessment that occurs under 1007A. And so you can see that, I'm looking, excuse me? No, I think it's above line 30. So that's referring to the additional percent. Subsection B is referring to the quote-unquote additional assessment. And so I'm looking for the literal percentage sign. Oh, here it is. So on page 1 in line 17, subsection A, except as provided in subsection B, the commission shall impose against an employer or if insured, the insurer, an assessment of 1%. The baseline 1%. Under subsection B, then there is an additional, under current law, 1% that may be assessed. The UEF departmental came in and said that they may assess up to, that's specified in line 29, up to 2%. So it would be adding 1%. So 1% under subsection A, subsection B is currently 1%. They wanted to make that 2% for a
We're
total
making
of
it
3.
1.5.
And now the amendment lowers it to 1.5, or a total assessment of 2.5 over the current law assessment of 2.
And I understand that the rest of the, or I guess it's a different amendment down below line 36, that when the fund equals 10 million, that the assessment would be suspended and it would go back to 1%?
So this is referring to the 1% assessment on page 1 under subsection A of 9107. The additional assessment that is being affected by this bill, that is specifically exempted from these trigger components. It's a fairly convoluted statute, but suffice it to say that there's a base 1%, an additional 1%, and then that base 1% is suspended when the fund balance under current law exceeds $5 million.
But the 1.5, if we were to pass this, will never go back.
Well, it authorizes UEF to direct the commission to collect up to 1.5%, meaning that they could lower it if they achieved a fund balance that they thought was sufficient. In
But
another
we're not
bill,
specifying what that fund balance is.
in another bill, the committee saw fit to instruct UEF to establish what they would need for reserves. Were they to meet their reserve balance, then it would be appropriate for them to lower that assessment again. But to my knowledge, the
You said it would be appropriate, but does that other bill require it?
no.
Okay. We don't want to put it in this bill?
Yeah, let's see how they recover.
One other question then. Thank you for all that explanation. That is helpful. We don't want to require it in this bill, though. I'm getting a sense that the will of the body is not to do that. There's a report here, correct, on or before December 1, on or before June 1st of next year, of the final report. Is that the special monitor is giving that to us and to Economic Matters, correct?
That's correct.
Far be it for me to recommend lots and lots of reports, because I know there's a cost to reports, but shouldn't we be getting an ongoing report? Shouldn't there be a report to the General Assembly every year about what's going on with you?
Oh, there is, in the form of the budget. So the UEF's fiscal condition has been of concern to the budget committees as long as I've been employed with legislative services. So back to 2015, there's been predictions of when the fund would become insolvent. And so it is a topic of conversation from year to year. There have been multiple studies. There have been multiple, last year.
I know there's been a study, yeah,
Sure,
for sure,
and
yeah.
Joint chair reports. This committee considered legislation last year related to increasing fees that must be collected by the Workers' Comp Commission. That was at the recommendation of UEF as a way to try to address their ever-dwindling fund balance. 2 years ago or 3 years ago, I think it was, this is the last thing that I'll mention, Senator Reedy, was that the Finance Committee shifted 1 percentage point of assessment from the subsequent injury fund to the UEF in order to prop up the fund balance. And during that time,
remember
UEF
that, I
actually
think.
saw their fund balance go up. It's been addressed many times, yeah.
But we're not, that's not been good enough for what we need now for this.
The shifting of 1% was temporary. It was only for a one-year period. And so while their fund balance increased slightly during that 1 year, it has continued to drop off.
In that reporting, because I'm assuming a lot of that goes to the budget committee, in that reporting, we're talking about that every year, do we know the state of how much they spend with third parties? Do we have do they give a breakdown of their third-party expenditures?
So,
Because that's been a point of contention that's been brought up.
and it was something that was discussed very seriously in the budget hearings this year, and I think that that's the reason for the special monitor. Is to specifically have that special monitor report on the third-party payer practices of the UEF, third-party administrator practices of UEF.
And then we'll see from there what we might need to do, if anything needs to be done.
Yes, my understanding from the budget analysis that was submitted by UEF this year is that their contention is that their TPA payments will actually decrease moving ahead, but whether that comes to be remains to be seen.
Okay. Thank you. Thank you, Madam Chair.
They're coming down slightly because of the new contract.
So they'll report back December 1st of 2025 with an interim report, and then on or before June 1st of 2026, a final report. So we do have 2 reporting dates besides with reporting to the other committees. Senator Ellis was next.
Yeah, thank you, Madam Chair. So, Nathan, a quick question. So this is uninsured employers fund, which is a part of the workers' comp system, so to speak, right?
Yes.
So when we talk about percentages going from 1 to 1.5%, do we have like projected numbers
Yes.
that we're talking about?
So the 1% increase was expected to result in additional $4.5 million in assessments for UEF. So it would stand to reason that at 0.5%, it would be $2.25 million a year, which would be enough to grow their fund balance year over year.
Thank you. And who is that assessment? Who has to pay the assessment?
Individuals who pay workers' comp claims. So if it's a self-insured jurisdiction, that jurisdiction, if it's an insured individual, it would be on the insurance policy.
So you're talking about governments, private businesses, everyone who pays.
Who did have appropriate insurance or coverage is paying for people who are uninsured.
Yeah, okay. And one final question, the monitor. So the monitor will be hired by which agency?
It would be designated by the Workers' Comp Commission,
Okay,
and then it would be paid by the UEF at an amount that is commensurate with the amount that the Workers' Comp Commission pays to retired judges to hear cases. I believe it's in the hundreds of dollars on a per day basis. Conversations with the commission lead me to believe that it would be that the monitor would work probably for a couple of weeks to a month at initial startup, and then only step back to 1 day a week or a couple days a month for the remainder of the period in order to continue to receive and monitor information.
okay, a little follow-up. So would it be, is it clear in the legislation that the monitor will have full access to the unemployment insurance fund and the,
I think that
or sometimes you have agencies saying, well, we're not going to give you information, we're not going to allow you in, we're not going to, and a lot of roadblocks. So is there anything in here which basically?
subsection B of the uncodified section 2 specifies that the special monitor shall monitor the financial condition of the fund for the period of a year. What I would say is that the legislation clearly charges the special monitor with monitoring the financial condition of the fund.
That's clear in the legislation. Okay, well, thank you.
Thank you, Senator. Senator Mounts?
Thank you, Madam Chair. Real quick, and do we know what that 1%, what the dollar value of that is?
Yes, if it were to have
Or,
increased.
no, 0.5%, I'm sorry. We're going,
Yes.
talking about 0.5%.
$2.25 million.
How much?
$2.25 million a year.
Okay, 2.25.
$2,250,000.
And then did the carriers, were they able to articulate how much that would impact their coverage or their clients? So the workers' comp bill, at what level would that affect the bill? Is it $5, $10 a month, or it may not be something that can be ascertained depending on different policies?
Well, Senator, it's based on the claims they pay. So let's just say you have Liberty Mutual pays a claim, and that claim is $10,000. They're going to pay 1.5% of that to the UEF. So when we get back to this fairness issue,
Yeah.
the companies that have insurance are the ones that end up paying for the companies that don't have insurance.
Yeah, right, yeah.
But it's based on claims paid.
Yeah, and I was just trying to understand, so, because that assessment will go out, but the entity that pays for that coverage, right, wouldn't their policy then be affected because the cost of the coverage is going to go up? And I don't know if you could, because there's so many different shapes and formulas to
The fiscal
configure
analysis doesn't put a number on it, but it does acknowledge, the fiscal and policy note does not assign a specific number. But to the extent that UEF expenditures, Chesapeake's expenditures related to payment of the assessment go up significantly, then it may impact rates.
Right, right.
But there's no specific number to offer.
But the specific number we know is the 2.25.
Is $2.25 million in additional revenue for the UEF.
Yeah, okay, thank you.
Which is itself an estimate.
Okay, have we answered all the questions? Has Nathan answered all the questions on Senate Bill 219? I don't see any other lights. Can I have a motion for the amended bill? Senator Ellis, thank you. Who's a second for the amended bill? Second. Senator Lamb. Oh, Ellis, Senator Lamb. All in favor of Senate Bill 219 as amended? Okay.
Opposed?
We need a roll call. So you don't want these people paid?
I don't like the companies that are paying into it having to pay for the companies that don't.
Okay, can I ask what your proposal would be to pay UEF? Because they have to have money to pay for these claims that have no insurance. This has been the process ever since UEF was created. That's how they've been paid. So, do you have another solution, I guess I'm asking? No, okay.
I didn't know I had to vote no, but I don't know.
All right.
All right, Madam, Madam Manager, will you take a roll call, please?
It's a party.
Senate Bill 219 favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
For those poor workers' comp injured people, yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
We did get a thing out of this. We got
I agree, better than it was.
a play party.
So that's a no?
No.
That's a no.
Senator Mounts, no. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
Up next is Senate Bill 447, which has been significantly amended and shown in a reprint before you. It generally codifies the Federal Emergency Medical Treatment and Labor Act, otherwise known as EMTALA, in state law with respect to pregnancy-related conditions. So if a hospital with an emergency department determines that a patient has an emergency pregnancy-related medical condition, the hospital must, using the staff and facilities available to the hospital, provide further examination and the treatment required to stabilize the emergency pregnancy-related medical condition, including termination of a pregnancy when termination is medically necessary to stabilize the patient or transfer the patient to another medical facility. If the emergency pregnancy-related medical condition has not been stabilized, the hospital may not transfer the patient unless the transfer is done consistent with the existing EMTALA requirements. So the bill also establishes protections for hospital employees, establishes penalties applicable to a hospital for negligent violation of the bill's requirements, and then makes other conforming changes. I'll say generally that the amendments narrow the scope of the bill to only emergency pregnancy-related conditions, strikes certain civil penalties applicable to a physician and an individual cause of action related to a hospital, requires the Department of Health to stay any final decision related to the bill's requirements if there's an ongoing federal investigation, requires the department to offset any state fine by the amount of a federal fine, and then even goes further to require a refund of a state fine if a federal fine is assessed within a certain amount of time. Paging through, I think you can see that on page 2 at the top, the bill explicitly narrows the bill to pregnancy-related medical conditions and removes a reference specific to severe pain as a condition. If you move over to page 3, you can see the amendments specify that medically necessary termination of pregnancy is included, and that the hospital must allow termination if the treating practitioner determines that it's medically necessary to stabilize the patient. The amendments strike on pages 4 and 5 what would have basically been restatement of the federal EMTALA requirements, and instead on page 3 in line 25 and 26 make that specific reference to federal requirements. At the bottom of page 5 are protections for treating healthcare providers, that a hospital may not penalize or take other adverse action, including some specified things against the treating healthcare provider if the provider refuses to authorize the transfer of a patient or the provider's treatment of the patient is consistent with the medical standards of care that, in the provider's clinical judgment, were necessary to stabilize the patient, and then, or the hospital employee if the employee reports a violation. The stay of state action is below there on page 6. And then finally on the back, there is the provision 20-214. This is the subsection B here. It specifies that except for as required in this bill, the licensed hospital director, or hospital governing board may not be required to allow within the hospital the performance of any medical procedure that results in artificial insemination, sterilization, or termination. So this is really the change of authorized to allow is really a technical correction of a stylistic change that was made in the drafting process. And that's all that I have.
Looks like Senator Washington has a question.
It looks like I do. Just a quick question. I wondered if the amendments change unfavorable decision on this bill, that they now support the bill.
Senator Lamb, do you want to respond?
Sure. So we've worked very closely with appreciated all the discussion, dialogue with them. They're now neutral, along with the Maryland Hospital Association is also neutral on this.
And Johns Hopkins too.
Yes.
Cool, thank you.
Hopkins was never the problem, were they?
They were never the problem.
It was the Catholic hospitals that had to be worked with.
letter here from Johns Hopkins saying they're unfavorable.
I think it was because of all the federal statute that was brought in, and that's all been excised out.
Yeah, they said it's duplicative and unnecessary, but
Right.
but does not help patients from Hopkins. So I wondered if they changed their mind as well.
They're also neutral on this.
Okay.
Yep.
I don't see any other questions. Oh, I do, Senator Reedy.
I didn't know if Senator Lamb had more comments. So what's the problem we're solving now?
The problem is sometimes women appear in an emergency room because
complications of a pregnancy or a miscarriage, and we have some hospitals that could have issues with treating that patient.
Do we have any documented cases where someone could not get a medically necessary
I was working with one
abortion?
hospital, who I won't name, who said that the doctor calls the ethics director at like 2 in the morning to get permission to treat a patient.
In other words, he's not treating the patient for the emergency in front of him till he gets permission. Suppose he doesn't reach that person at 2 a.m. that gives him permission.
Are they bringing them to that hospital?
Yes, people are being brought to that hospital. There's 4 Catholic hospitals in Maryland, and that's the concern.
Are we not going to run afoul of some other requirement, of some other federal, I guess that's why we put the language in the bill. Yeah.
So there's been a federal law on the books for decades called EMTALA that requires emergency departments everywhere to stabilize a patient. You can't dump a patient out. You have to
Right.
stabilize them
Right.
before transporting them or provide any life-saving care that they need. That's been the case for a long time, and that was enforced by the federal government. There have been cases that have reached the Supreme Court or are in process of reaching the Supreme Court. The Biden administration was enforcing EMTALA on hospitals all across the country. And they were actually suing some hospitals in Idaho. With the change in administration, the U.S. Department of Justice has pulled those back. And so it looks like there's no enforcement of the federal EMTALA statute on hospitals that might choose not to perform a life-saving abortion when someone needs it. And to answer your other question about why would they end up at that hospital, obviously if they have the
it's an
need for,
emergency,
right, an
they're brought
ambulance
there.
might not
Yeah.
choose like which hospital to take them to, just take them to the closest hospital.
Yeah. It just seems like a lot for something that happens almost never. There's very, very, very few times that you have to perform an abortion on a late stage pregnancy because where you knew going into it that was the problem. I mean, there could be times where, I mean, it's the idea that it's fine. I just feel like
There actually have been cases in Maryland that have been documented. If you look up a USA Today story, it does reference a case in one of our faith-based hospitals here in the state where somebody did not receive the care that they need.
I don't see any other questions. Do I have a motion? Senator Lamb, you were the favorable with amendment, and Senator Guy was the second. All in favor of Senate Bill 447? Better call roll, Madam Secretary.
Senate Bill 447, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mounts. No. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey. No. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
All right. Next bill on the list is Senate Bill.
We added another sponsor had asked earlier, but it came in a little bit after we dropped the bill into the hopper. Senator Love wanted to be added as a co-sponsor.
If possible, if you're adding, I'd like to
You
be
wanna
added
add?
too, please.
Okay.
I've made a note. Yep. There you go. So next bill on the list is Senate Bill 748, which as amended and shown in the reprint, expands the information that the Department of Health in partnership with specified entities must incorporate into relevant public health outreach programs to include information for healthcare providers on treatments approved by the FDA for Alzheimer's disease and related dementias, and to increase understanding and awareness of early treatment of Alzheimer's disease and related dementias. And then the Department of Health, in collaboration with the State Designated Health Information Exchange, must establish and maintain a publicly accessible website that includes specified information regarding Alzheimer's disease and related dementias. So there are a few amendments. First makes a technical correction at the top of page 2 to the name of the Virginia I. Jones Alzheimer's Disease and Related Dementias Council. That was missed when the name was changed several years ago. Let's see, and expands the information shared with healthcare providers to include relevant information on treatment use and outcomes. And so that's in line 15. The amendments further expand the information shared with the public to include approved treatments and related information, including information related to treatment outcomes based on biological sex. And so that you can find that after line 23. And then the amendments expands the required elements for the website, specifying 2 additional data elements on page 3, and that is the co-occurrence of Down syndrome or trisomy 21, and then also the inclusion of the type of dementia that the individual was diagnosed with.
Move favorable as amended.
Thank you,
Madam
Senator
Chair.
Kramer. Do I have a second? Second. Senator Hayes seconded. All in favor of Senate Bill 748 as amended? Unanimous vote. Thank you.
Next is Senate Bill 792, which as amended and shown in the reprint requires the State Board of Dental Examiners to reinstate an expanded function dental assistant certificate, that is expired only if the holder has completed the continuing education requirements set by the board, has submitted a renewal application before the deadline set by the board, and then pays a renewal fee. The bill also expands the authorized courses of study that an applicant may complete to qualify for a certification. So the amendments, which you can see largely on page 3 of 3, specifies that a course of study for initial certification must include 35 hours of instruction consisting of both online and in-person instruction, and clarifies that the regulations adopted by the board must include hands-on training. The board has signaled that they are in favor of the bill following the amendments, and there is no fiscal impact.
Any questions for Senate Bill 792? Do I have a motion? Senator Mounts, motion favorable, and Senator Reedy second. All in favor of Senate Bill 792? Okay, unanimous vote. Thank you. Okay, now we move to Amber.
Okay, we're going to start with Senate Bill 215, which is a departmental bill that, as amended, strikes language authorizing cannabis events and repeals the authorization for the Cannabis Administration to issue on-site licenses during the second licensing round. The bill still alters the framework for on-site establishments to operate in the future, including authorizing the establishments to operate as a food service facility if all requirements of a political subdivision are met. Additionally, Senate Bill 215 extends the delivery of medical cannabis by 1 year until July 1, 2026, authorizes cannabis business transfers for the purpose of an ESOP, clarifies that a political subdivision that fails to adopt an ordinance establishing distance requirements for cannabis licensees will be subject to the requirements in state statute, and specifies that a cannabinoid beverage is not a food product to ensure it is taxed at the higher cannabis rate. There is a reprint with all of these amendments. At page 3, you'll see the authorization for delivering medical cannabis for an additional year. This amendment is based on the fact that no micro dispensaries are yet operational to fill this delivery void. Further down on page 3, you'll see that there is bracketed brackets around the on-site consumption licenses. This is under the second round authorization for issuing licenses. So we're removing, the committee is removing that in this reprint. There's also a parallel change removing the on-site license award authorization on page 4. At page 5, there is a clarifying amendment requested by MCA related to building out the on-site structure. This is just clarifying that a on-site establishment cannot process cannabis the way that a processor license authorizes, but they can create single-serving products for immediate consumption. Further down, after line 22, there's an amendment requested by Mako. This is related to the authorization to operate as a food service establishment, just ensuring that the on-site establishments meet the political subdivisions requirements for permits and certificates to operate as a food service establishment. At line 25, there's a technical amendment to provide internal consistency with the clarifying amendment above related to the single-serving products. At page 7, and this amendment I don't believe I mentioned before, it alters the supply requirements for cannabis dispensaries. So when the General Assembly passed the legalization of cannabis, force cannabis dispensaries that, particularly cannabis dispensaries that are vertically integrated, had to retain at least 25% of the cannabis and cannabis product space in the dispensary for social equity licensees, growers, and processors. This amendment is taking out the growers and processors from that to streamline enforcement for the administration to only ensure that dispensaries are displaying product from social equity licensees. And this doesn't apply until supply becomes available from these newly licensed social equity licensees as determined by the administration. So the administration will determine when this kicks in, when there's enough supply for all the dispensaries to hold 25% of their stock in social equity licensees. Page 8, and I apologize, there was an exhibit, I had it in the reprint for the last time it was on the voting list, but I didn't get it copied. Anyway, the amendment here is intended to close a loophole in statute that political subdivisions have been exploiting to avoid issuing permits to cannabis licensees. We have a letter basically where the Department of Planning and Zoning in a jurisdiction refuses or cannot approve a cannabis dispensary application as it is not a principally permitted use in the county, due to the fact that the county council failed to pass an ordinance that would have amended the zoning code to make the sale of cannabis a permitted use. So this is just closing that, saying that you're still subject to the state requirements if the jurisdiction fails to pass such an ordinance. And then the final amendments are on the last page. The amendment related to excluding a cannabinoid beverage from the definition of food was requested by the Comptroller's Office to ensure cannabis beverages aren't classified as food for tax purposes. And finally, the final amendment advances the effective date for the purpose of effectuating the amendment at page 3 as the authorization to continue delivering medical cannabis expires on July 1st, 2025. So to extend that, we needed, the bill needed an effective date of July 1, 2026. Or 2025, sorry. Everybody.
Is the ESOP in here? I may have missed what I read it for a minute.
Oh, did I miss it? It's supposed to be in here. To supply to individual.
Because we took out the sale.
Oh, I'm sorry. Yes, there is an ESOP amendment. I did not annotate it. I missed it. I'm very sorry about that. At the bottom of page 8, it's hiding from you between pages 8 and 9. There is the ESOP amendment, which basically there are lots of prohibitions on the transfer of ownership or control of a license under the title. This is excluding the sale of a cannabis licensee to the licensee's employee through an employee stock ownership plan as defined under federal law, so that those ESOPs can take place. I'm sorry that I missed annotating that for you guys.
ESOP is an employee purchase business. The employees can purchase the business. It's got a lot of federal regulations, how it happens, but.
And the federal code is cited in the bill to make sure that those ESOPs align with federal law.
Senator Reedy?
The amendment on page 8 that you went through on the local, I don't remember that coming up in the hearing or anywhere. Has that been seen by any of the people it might impact or their representatives? Like MACO or?
It has not been shared with MACO at this point. It was brought to us by MCA and the governor's office because during the process of debating this bill and moving it through the process, these letters started to come out where licensees were not able to get zoning approval from their local jurisdictions, which was outside the intent of the General Assembly when legalization was passed to begin with.
There was a lot of things that were outside the intent that we keep having to come back on, and this seems punitive to me. I'm not a fan of that amendment, so it's not your fault. You're the not aiming that at you. So there's that, and then okay, that was one thing that jumped out at me. Some of the other stuff, I mean, I agree with some of the things in here, but yeah, okay.
Senator Kramer?
Thank you, Madam Chair. So do I recall that nothing has been done with regard to the issue of how many single-serving packs or single-serving products an individual could consume? It specifies it has to be in, this limited quantity, but does not specify how many of those limited quantities. Is that still the case?
That is still the case. It hasn't been addressed. I think part of the idea with delaying the awarding of on-site consumption establishment licenses is that this bill does not resolve a lot of the questions that the committee and the public was still having about how they would work.
But it still allows for this. In other words, or am I mistaken?
Sure. So
Under the bill, should it pass?
should the bill pass, this takes out the authorization for the next cannabis licensing round for the administration to award these licenses. So it delays the effect on these licenses. After the second round by the administration, there cannot be additional licenses awarded until there's a market demand study.
Understood. But if passed, it would allow for the serving of these products, correct?
Not at an on-site consumption facility because they cannot get licensed in this next round. So there be no licenses for these establishments to operate.
Okay, so these licenses, should they be granted, no one's going to be serving on site, is that correct?
Until 2026, right?
Not until at least, let's see what the date is. Not until at least after there has been a market demand study, which isn't going to be conducted until 2026, I believe, but I can get back to you on that.
So let me ask you this.
It gives you another legislative or the committee another legislative session to consider how to address
All right,
this issue.
so
by
it
delaying it.
might not be appropriate for me to panic now to avoid the rush later and just let it go for the moment, because there will be another bite at the apple to address concerns that I have with regard to on-site consumption.
Yes.
Is it?
I will share with you, it may or may not get out of the House.
Well, would it just be easier for me to vote against it and be done, or? Okay, that's all I got. Thank you, Madam Chair.
Senator Kramer, there are a lot of good things in here that need to happen. So, this was a vehicle to do some of the other things that the cannabis administration needed. But I'm not sure that everything's going to be blessed by the House. They don't have a bill. They're waiting for our bill.
Thank you.
Senator Hayes, you have a
Oh,
question?
cool, yes, thank you, Madam Chair. And I think, Amber, you may have answered my question. On page 3 where it says removes the authorization to the award of on-site licenses, that's just saying in this next round.
In the second round of licenses,
Right.
it's removing that authorization so that they won't be awarded during the second round that the administration is preparing
Right.
for.
And the market studies typically take, what, how long?
I do not know that answer for you.
I know some
I would
other
say at
studies,
least
like-
6 months, but I do not know for sure, and I can
Yeah,
get
we
with
can
the
find out.
administration to ask that question.
Right, no. And this does nothing as it relates to, it keeps, when are the delivery licenses supposed to be considered?
On page 3?
Yeah. Oh, that's under the micro licenses?
So this is, right now, dispensaries that were issued a license under the Medical Cannabis Commission and have since converted are still authorized to deliver medical cannabis right now in current statute through July 1, 2025. The intent of that language during legalization was to wait for these micro dispensaries to get licensed, as they'll be more of a mobile operation and will fill the void of delivering the medical cannabis.
Right.
But as none of them are licensed, the industry came and requested an additional year of authorization to deliver only medical cannabis. So
Only
this is just for not delivery of adult use, only medical cannabis.
Has the schedule for delivery of adult use been identified?
No.
Gotcha. The only thing, and I know it's not in this bill, colleagues, but I will say, that's probably the most lucrative, unregulated industry that's going on right now. There's plenty of apps that exist that aren't regulated where people are delivering, God knows what. And so at some point, probably next year, probably we have to deal with it, but I know it's not in this bill. Thank you, Madam Chair.
Any other questions? Oh, Senator Washington?
Thank you, Madam Chair. Just going back to page 8 on the political subdivision question, you mentioned that there were some letters that were sent about this amendment. Who exactly sent those letters and who requested this amendment?
So the amendment was initially received by the committee from the Cannabis Administration, as some of their licensees were bringing letters from County Department of Planning and Zoning whose permits were being denied solely because the county had failed to adopt an ordinance as they were expected to do by January 1st of 2025 under current statute.
Got it. And so the letter came from the Cannabis Administration or from those businesses?
I'm in receipt of a letter from Harford County
Got it.
that was sent to a licensee, and she shared that with the Cannabis Administration.
Got it. And under, it says provisions in subsection B of this section, is that enough for the zoning authority to be able to implement it without the council passing any meaningful legislation?
Based on my discussions with the Cannabis Administration, this language came from them, yes, and I believe also as council, it's legally sufficient
For the local zoning authority, for the local zoning?
to be able to implement, correct.
Okay.
The locals are also not precluded from now adopting an ordinance if they want to not be
That was my
subject
next
to the
question.
state statute.
Right.
It's just, if they don't do one, then the state statute takes over so that these licensees can start being permitted to operate.
And one of those letters didn't come from Prince George's County, did it?
Not that I've received.
Perfect, thank you.
Thank you, Senator. Senator Mounts?
Thank you, Madam Chair. I'm looking for the part about the ownership requirement, the 5 years. Wasn't that in the original?
Madam Chair is going to address your question, Senator.
Initially, we were trying to allow businesses that already had owned their business 5 years before transferring that they could sell. But there was a lot of pushback from the minority businesses that are trying to get up and running, because if buyers were investing money in purchasing these already developed businesses, they wouldn't be investing in the new businesses. So we were asked to remove that amendment.
So you were asked to remove the amendment?
Yes.
And because, but we're, okay. So who was asking, who asked to remove the amendment?
Mainly the Black Caucus, because the minority businesses they're not up and running yet.
Right.
There's only so much investment money to go around.
Understand,
Yeah.
okay.
So now we're in, I think, year 3 of this transfer.
Year 2 will conclude at the end of session,
Okay.
and so there'll be 3 more.
So it'll be 5 years before you know it, Senator. Senator Reedy.
Well, I'm just a little disappointed because that was one of the main things we discussed a lot about that issue. And there are already minority business owners that this would have benefited. So there's just not, it's just not smart. It's just not smart economic policy to not allow for people who've made that investment for 3 years plus, 4 years plus, to not be able to turn around and pivot just so they can scale. I mean, that's the concern I have. I don't care about who has the licenses, but, and I understand it's important to try. I know the goal is to grow minority businesses, but some of these people that were going to benefit from this were minority businesses. So I don't want, I mean, you know, at least that's my understanding. I'm happy to be told I was wrong, but I felt like we went through a whole cycle of talking about this being in here, and all of a sudden we get to the voting session, it's not in there. I mean, I thought that was actually a really good feature of what we were doing in the bill. Now, if we come in, I feel like the kid who thought he was going to get like a drum set for Christmas and he got coal in his stocking, this got taken out. And then we added in the thing about, you know, interfering with the locals again. And, you know, I don't know, it's just a little frustrating.
The issue with the locals was addressed in the original bill, and some have ignored it. My county did their change when they were supposed to.
I think my county did too, but
some
we never
counties-
should have done that to the locals, but that's a different, I know that's a different debate.
You know, Senator, if you remember our discussion the year that we put that in, do we want illicit drug markets on the street corners, or do we want licensed cannabis sellers in buildings and doing it legally? That's the issue, because 70% of the people voted for cannabis.
I know.
If we don't put them in legal, you know, oversight kind of facilities, they're going to buy it from somewhere.
I think a lot of that 70% assumed we were voting so people can smoke pot on their own, not that they were going to have a pot shop next, you know, could be anywhere in their.
Well, where were they going to buy it? Yeah, that's the problem. You answered it.
But
You
we're
answered
going to
it.
cite the voters. I understand. I get it. It's
Okay.
just, you know, we go.
So all we're doing is reinforcing what the original bill said, and that's that every county needs to have zoning requirements for cannabis.
I think there's still going to be a lot of illegality, but I understand the argument about the legalization. So thank you very much.
Mr. Vice Chair?
Thank you, Madam Chair. I just want to address Senator Reedy's concerns. You all remember 2 years ago when we switched from medical cannabis to adult use. It was the Attorney General's opinion at that time that you couldn't treat one class of licensees different than you treated others, right? I think even now in this heightened environment where, you know, minority participation is under attack at the federal level and other opportunities, it gives us even further exposure if we were to treat these licenses separately and not treat them together. I think the concern that has been expressed mostly, especially, there's 143 licenses that are up and running. I would probably say there's less than 2%, maybe less than 5% that are minority owned. I don't know what the exact number is. I'm just thinking off the top of my head. And so the assertion that, you know, there's some minority business, which is true, right? There will be some that benefit, but largely it will disadvantage a large portion of those social equity licenses. Now, look, the folks that have been operating under, a medical cannabis license and then took on this. It's a fair argument, right? I don't dismiss how hard it is to operate in this space, in this business, right? But we as a state and as a legislature has said that it is a policy decision of this General Assembly to make sure that there's equity and individuals being able to secure a license and being successful. And so I think all of that combined with the basis premises of why we didn't separate these two classes in the first place, based off the Attorney General, is why we've come to the decision to, get this very important piece of legislation and regulation through this year, so some things can take place. And then in future years, we'll come back and revisit some of these items. Thank you, Madam Chair.
Thank you, Mr. Vice Chair. All right, I see no other questions. Do I have a motion for the amended Bill 215?
So move.
Senator Ellis and Senator Hayes. Should we call the roll? I think we should call the roll.
Senate Bill 215 with amendment. Vice Chair Hayes.
Second. Yes.
Yes. Senator Kramer.
All right, I will not panic now to avoid the rush later. I will give a reluctant yes.
Senator Kramer, yes. Senator Reedy.
I'm voting no. I think it's a little bit of a missed opportunity with this bill, so I'm voting no.
Senator Reedy, no. Senator Ellis.
Yes.
Yes. Senator Mounts.
No.
No. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
For the reasons articulated by Senator Kramer, I also share concerns with this bill, so I'm reluctant, yes.
Senator Guile, yes. Senator Lamb.
Ditto Senator Kramer.
Senator Lamb, yes. Senator Hershey.
A non-reluctant no.
No. Madam Chair.
Yes.
Yes. 8-3, the bill passes.
Saved all the good stuff for the end.
Okay. Our next bill on the list,
Okay. Amber's still up.
Senate Bill 365 establishes a nonprofit organizations navigator within the Department of Commerce. The nonprofit organizations navigator is appointed by the secretary and must provide technical assistance to nonprofit organizations in obtaining access to and applying for state grant programs, work with nonprofit organizations and units of state governments to resolve procedural complexities and delays in the grant-making process, collect and share information on opportunities for federal, state, and local grants with the nonprofit organizations, and represent the interests and concerns of nonprofit organizations as a member of the Mega Council through the termination date of the council. Amendment 1 establishes, that was offered by the sponsor, and you see it on page 1 of the reprint, makes the bill an emergency measure. The remainder of the amendments are offered by the chair, and they appear at page 9. Generally requires the department to submit a report by January 1st, 2027 that includes data to assess the impact of the bill, and also sunsets the bill as of June 30th, 2027. The types of information the report must includes the number of nonprofit organizations that received assistance, total grant applications completed and submitted as a result, and the total amount of grant funds awarded. It also establishes a requirement that the Department of Commerce collect sufficient information from the non-profit organizations so that the report can be done.
Senator Ellis, you have a question?
Yeah, thank you. I have a question. So there was an article today, a few days ago, about a lot of these nonprofits and the big salaries that the CEOs and officers making, $1 million plus, 600,000 plus. And here we have a tight fiscal situation, and we want to spend state money on helping them. I know a lot of nonprofits serve as a really good purpose. A lot of the best nonprofits are served by volunteers. So why do we need to spend any state money to get to help these organizations that basically either have great volunteers or overpaid people. I mean, and they don't pay taxes. Did someone say that? You know, I just have issue with this, so.
So Senator Ellis, the problem is helping people find those great nonprofits. Groups like Partners in Care, a lot of elderly people don't know that they can have Partners in Care come and do home repairs and take them to doctor's appointments. That's just, and that's not big salaries. The YWCA for my county is the only domestic violence provider in the entire county. I think there's a lot of nonprofits that do good work, and I think the senator, the good senator, vice chair of EEE, is trying to help people get connected to the nonprofits that can help them. So I think that was her point.
Yeah, I understand that's a
Okay.
good point. But it seems like, I'm reading the fiscal note, so this is, this navigator will be used by the nonprofits, not necessarily the people looking for help from a nonprofit.
I may have misunderstood. I thought it was a number of people could call
To help them find grants.
to help them
Simplified
find.
grants, yeah.
No?
It's a bill, the Navigator is helping nonprofit organizations, particularly the ones that you talked about that are smaller in scale. They don't have the large salaries to identify grants, help them to complete grant applications because finding grant writers can be difficult. Those kinds of things is what the Navigator is for.
What's
Yeah,
the fiscal
I would-
note?
The fiscal note does not take into account the fact that this became an emergency measure, but I did reach out to the note writer. Even with this being an emergency measure, the cost for the one person is less than $100,000. The fiscal note puts it at $73,900 in FY 2026. This would be a little bit more than that because they're starting earlier under the bill as amended, but it's within the $100,000 threshold.
Yeah.
Senator Ellis?
I'd love to hold this bill to look at it and see exactly, there's some
You
doubt.
always, you can always hold a bill.
Yeah. Thank you, Madam
Thank
Chair.
you. Any other questions before we move on? Okay.
Okay, moving on, we're at Senate Bill 689. Okay, so Senate Bill 689 requires banking institutions, credit unions, and mortgage lenders to include a provision in all conventional home mortgage loans that allows any of the existing borrowers to purchase the property interest of other borrowers in the event of a divorce. The affected financial institutions must disclose the assumption provision in writing to a loan applicant before completion of a loan application. The First Amendment is technical. The Second Amendment simply strikes language in the bill that would have made the act retroactive as offered by the chair. So that amendment is at the back of the bill on pages 6 and 7.
Senator Gile, move favorable. Senator Hayes, your second?
Yeah, absolutely.
Okay, we have a motion and a second on the amended bill. Senate Bill 689, all in favor? Anyone opposed? All in favor, thank you.
And the last one, oh, sorry, no, two more. The next one is Senate Bill 842, which authorizes the executive director of ATCC to seize electronic smoking devices, or ESDs, that are sold or offered for sale in violation of the business regulation article without a warrant. The executive director must give notice of a seizure to the person from whom the ESD is seized at the time of seizure, stating the right of the owner or other interested persons to file a claim for return of the seized property. And this is generally the same process that currently exists for contraband alcohol and tobacco products. The bill also requires each ESD wholesaler, distributor, or wholesaler importer to make specified records, keep those records for up to 6 years, and allow the executive director of ATCC to examine the records. There are a number of amendments from the sponsor, which generally strikes provisions in the bill related to seizures specifically by peace officers and those related to the regulation of OTP, other tobacco products, and does what was described. You'll see a lot of language is stricken from the bill on your reprint. If you go to page 8, There is an amendment offered by the chair that repeals language in current law that authorizes an ESD manufacturer licensee to sell directly to a consumer through a mail, online, or telephone order, addressing concerns about minors ordering ESDs online with no age verification mechanism. And the remainder of amendments are at the back, starting at page 10 of the reprint. Basically, the bill retains language on page 10 regarding record-keeping retention policies and requirements to allow ATCC to review those records, but the amendment applies those provisions to an ESD wholesaler, distributor, and a wholesaler importer. And those amendments continue on to page 11. And then at page 11, the amendments authorize the executive director of ATCC to seize contraband ESDs and establishes the seizure process. The amendments remove the authorization for a peace officer to make these warrantless seizures. And there are conforming amendments to remove peace officers from the seizure process in general. Finally, at page 13, there's an amendment that authorizes the executive director of ATCC to adopt implementing regulations.
It's for the children.
Move favorable.
Don't vote against the kids.
Senator Reed?
Questions. This repealing of the ability to purchase them, a consumer to purchase it through mail, computer network, telephone network, electronic network. I know the concern we have about kids getting it, but did we even have a hearing? I mean, this seems like a pretty big policy change. Or did I miss, I may have missed it, I'm just asking.
The bill that I had, which was the vape registry, we did discuss the online sales and things like that. So that was part of that other bill. So this is in this. So there was an opportunity at least to discuss this issue. And I see Amber, the
We're
chair.
not passing that other bill. Do you remember there was a $75,000 registration fee?
I remember.
Yeah.
I remember that bill.
So we brought that particular amendment.
So this would say that you can't basically buy vapes online anymore in Maryland?
Age verification.
Unless you have age verification.
Right, and so this applies specifically to manufacturers of ESD. So those are the entities that are really selling they're selling to the retailers, other wholesalers in the state,
But
a
they're also
licensed vape shop vendor.
sometimes direct selling, and they need, if they're gonna do that, sorry to interrupt you, but if they're gonna do that, they have to be okay, all right. And then I think I had one other question. The executive director may seize, the executive director now can seize alcohol that's illegal or cigarettes that are illegal without a warrant, correct?
Correct. This is the same process that is used for contraband alcohol and tobacco products by ATCC.
I assume that means the executive director or his designee that works for the executive director but not just any peace officer.
Correct. And that's why the peace officer language is taken out of the bill. It has to be the executive director or someone at ATCC at his direction.
Okay.
Or her direction.
Yeah. And they have warrantless search, they have warrantless ability because otherwise you find the stuff.
As a condition of their license, they
licensure.
have the ability to enter the business at any time.
And so we're making this a condition of the license to sell. Gotcha.
Correct.
Okay.
Applying the same standards to the electronic smoking devices.
And if your product is seized, you get a certificate and you can go contest it later, correct? There's a process. to
Correct.
contest- Okay, all right. No, thank you. We've had several of these bills, I'm just making sure I remember which one.
You know, remember though that under the comptroller, before this was ATCC, before Senator Kramer helped us change all this, they had most of this ability. When they became ATCC, they lost the enforcement ability, and that's what this bill's done, is it's given them back the enforcement ability. Thank you. Senator Washington?
Yeah, thank you, Madam Chair. I just remember us going through that tour with ATCC. That was really good and well done. And I remember there being some issues of enforcement for some of these liquor stores that sell the fake cannabis, if you will, or CBD. I wonder if this still allows them to enforce it if it is illegal for them to sell it under this bill. Does that change that at all?
So this bill does not address that issue. There is legislation that the committee passed earlier this session that dealt with closing sort of the loophole, enforcement loophole that ATCC was talking about related to those CBD and THC vapes.
Good. Can you point me to that bill later?
Yes, I'll get you the bill number. I don't know it off the top of my head,
Sure.
Senator.
Thank you.
Senator Mouse?
Yeah, I'm trying to recollect the hearings from the other bills. Does this address the issue where the vendors or the store owners were here saying we've been inspected and we've called to have these other stores inspected, but they haven't been inspected? And does this address that?
Supposed to. They've hired 100 new inspectors.
Right.
And,
Okay.
you know, as contractors, they're not employees, but contractors, yeah, and they've trained them.
All right. Thank you.
Any other questions? Can I have a motion for the amended Bill 842? Senator Ellis, who's going to second? Senator Kramer. All in favor of the amended Bill 842? Unanimous vote. Thank you. Thank you. One more for you?
One more. All right, I have one more, just little bill here. SB 848, the Public Health Abortion Grant Program Establishment. So Senate Bill 848 establishes the Public Health Abortion Grant Program and Fund within the Maryland Department of Health to provide grants that would improve access to abortion care clinical services. Under the ACA, the federal ACA, American Affordable Care Act, carriers are required to add $1 per person to insurance premiums, and then the carriers have to hold this money in a segregated account that can only be used for abortion care clinical services. The carriers' accounts currently have upwards of $19 million in funds collectively in these segregated accounts that the carriers cannot use for any other purpose. So the bill then requires the insurance commissioner to order the transfer of funds from these segregated accounts initially by September 1, 2025, and then annually on July 1, beginning in 2026. The bill further requires the governor to allocate $2 million from these segregated accounts to the new special fund by budget amendment this year, and then beginning in fiscal 2027, the governor must appropriate at least 90% of the ending balance of the segregated accounts that exceeds disbursements by a carrier for an insured abortion care services after the 15-month period during which the carrier could still receive claims following the end of the plan year. There is one technical amendment at page 3 correcting a date that could not have been implemented. This amendment was also adopted in the House. It just simply changes December 31, 2025 to 20. Make sure I did the amendment right.
December 31st, 2024.
Oh, yes. Sorry, it's the amount of interest that was accrued as of December 31, 2024. So at the end of 2024 is what they're basing the transfer off of, since December 31, 2025 has not yet happened. So that just corrects that date.
Senator Reedy.
I'd like to hold the bill.
Okay.
Just can I ask a question too, just before?
Sure.
And respect the hold, but can we just explain the fiscal note one more time? I mean, I keep hearing that it's $19 million, but I just want to make sure I
It was a
understand.
federal requirement, but
Yeah, if you
certainly
don't
Amber will
mind.
explain
Thank you.
that.
Sure. So under the Affordable Care Act, carriers were, if they're going to offer these abortion care clinical services, are required to add to insurance premiums $1 per person. Abortion care services abortion care clinical services do not cost $1 per person for any of these carriers. So it's just, the funds are then put into a segregated account that can only be used for abortion care clinical services. So there's $19 million, 19.3 is what the fiscal note says, just sitting collectively in these segregated accounts of carriers that the carriers cannot use because they don't have enough claims for abortion care clinical services. That would then, by order of the insurance commissioner, be transferred into the special fund created under the bill, and then could be used for its restricted purpose of providing abortion care clinical services.
Okay, I understand that, and thank you. The $19.3 billion or $1 million is being held by the carriers right now because
Yes.
they've collected it through premiums.
Correct, that is
Okay.
money that they've already collected through this $1 fee, premium fee, and it's already held in segregated accounts that they cannot access for any other purpose.
But Maryland did not already have this special fund set up.
No,
bill
this special
has to.
fund is new.
It's new. So why, do we know why the carriers were collecting all this money and a fund had never been set up previously?
The carriers are collecting the funds to be used for their insureds, but they're required to hold it in a segregated account to ensure that that money is only used for abortion care clinical services. There was no indication at the time of ACA that there was going to be all of this money in these insurance carrier segregated accounts that cannot be accessed. Once it was identified that there's just money sitting there that can't be used, then the bill came about. I believe there was a similar bill introduced last year, and this bill is just a better version of implementing that has been worked on during the interim.
Okay, and then one more question, and
Sure.
I appreciate you doing a great job of answering these. Does this mean that every other state is having to do this same thing since ACA's federal policy?
So I believe that I'm not sure. I don't believe that's the case. I believe the states had to make some decisions that then if the carriers were going to do this and provide and pay for these services, which we, in Maryland, they do, they have to have this segregated account. It only applies if they're offering these services within their plans.
Okay, you're still doing a great job, but I got to follow up then.
That's fine.
Yeah, so does that mean then that some states could have told their carriers, do not collect this $1 per person?
Not if they're covering under ACA these abortion care services, they have to do the premiums.
If they chose to want to cover those services, but if they chose to not want to cover those services, they could have said.
They don't have to collect the $1 premium. The $1 premium applies to the abortion care clinical services and must be held segregated.
So the states that don't have abortion care clinics or don't approve abortion care aren't collecting this money.
That's what I was going to get. Okay, thank you both. Thank you, Amber.
Senator Lamb.
Yeah, thank you. Just a clarifying question. I think some of it was already touched on by Senator Hershey. The funds here can only be applied to clinical services, right? So not infrastructure improvements, physical safety
Correct.
improvements,
They're
just clinical.
100% restricted to abortion care clinical services. That's why carriers cannot use them for other purposes and why the money is just sitting there.
Right, okay, thank
Why
you.
the bill didn't pass last year. Okay, can I have a motion for the amended bill?
Senator Reedy's motion to.
Oh, that's right, you held it, okay. You get 1 day hold. So if you have an amendment, tomorrow's the day. Okay, thank you. Senator Mounts?
Yeah, I mean, that would be the thing. If we wanted to offer an amendment to the bill tomorrow. would be-
Tomorrow.
Yeah,
We're running out of time.
gotcha.
Okay. We're voting every
Every
day.
day.
We don't have any hearings, so we'll vote whenever we get off the floor, we'll vote. But tomorrow's going to be a long day, so be prepared. Yes, sir.
We had some questions in the whole. I'm just curious, so how will the state use that money, Amber?
For abortion care, for clinical abortion care.
So it will go to subsidize,
It will,
Correct.
go to subsidize
It will
the clinical
subsidize
services
the,
for?
the clinics that are offering these services. And for people that do not have the financial capability to pay for the services, this money can, or for whatever reason, don't want to use their insurance to pay for the services, this money can be used for the abortion care clinical services of those patients.
Yeah, but those patients are currently, the service is paid for,
they're
currently.
running out of money.
There is very little money left. That's why this grant program is being created, so that the entities that are providing the services, a lot of it comes from donations and grant funding and things of that nature. That money is drying up. So this grant will allow those providers to continue offering these abortion care clinical services.
So does the state now pay for any of these services through Medicaid or?
Donations, through donations.
So if a person is using Medicaid to pay, in Maryland, Medicaid will cover abortion care services. There are other reasons that a person who has insurance or doesn't have Medicaid may not be able to pay for the services.
Yeah, okay. It seems like, since Medicaid is paying for it, all that stuff, I mean, it seems like this money might go into a fund that just sits there now. I mean, unless, if this fund's available, you're saying that Medicaid wouldn't pay?
No, Medicaid still covers those services, but only for the people that are covered by Medicaid. There's a large portion of the state and people from out of state that do not have Medicaid services.
Okay, so, okay, I got it, yeah.
Senator, you may not have been here for the hearing, because we've all been at other
Yes,
bills, but I remember the lady sitting to the right that was the director of a clinic out in Western Maryland, and she said they were out of money.
Okay.
They were using a lot of personal donations, private donations, and they had reached the point where they couldn't help women at this point.
Yes, I did miss that, so I
thought maybe.
apologize. I'll watch the bill here.
Okay, good.
Thank you.
Thank you. Senator Reed.
Part of the reason I held it is because I thought we might want to keep moving, so I know I'm asking a question. But, because tomorrow I think we may have some ideas for some ways to improve this bill, if that was possible. But
tomorrow.
yeah, well, I mean, I'll hold it as long as you'd like, but you told me tomorrow, so I'll hold it like an infant. Can I ask a question about, you just mentioned something that's interesting. So we're doing this because people are running out of money, but it's going to also benefit people who come from out of state. So our ratepayers' money is going to go for paying for people to come from out of state with this?
So no one can access this money. The ratepayers can't access it unless they're getting abortion care clinical services. So
But it's our
not like-
ratepayers, right?
It is our ratepayers. The money is not restricted by state. The money is restricted by purpose. So as long as the purpose is met for abortion care clinical services, the funds can be used.
That's intriguing. Okay, thank you.
I don't know what's coming. Senator Lamb?
Yeah, I think just to address something that Senator Ellis brought up earlier, I think only 1 of 3 people in Maryland have coverage for required abortion care that they might need. So just kind of trying to keep that in mind, obviously. And then I think only 1 in 3 people have coverage with required abortion funding right now. So there are a lot of people that don't have coverage for that. And then the funds currently are unused, so they're just sitting in an account. So this would at least enable them to be used.
No copays. I thought that you get abortion without a copay.
I don't think so. I don't remember that. Senator Kyle?
Thank you, Madam Chair. Just to follow up on what Senator Reedy had asked. So Amber, just so I understand where like the funds are being held. So if our state's payers, I understand this is a federal law that requires them to do it. And when the insurance companies receive it, is this money being held like that this came from Maryland individuals? Like, is it, or is like, I'm just trying to envision is like insurance company, health insurance company, like keeping this in a fund that's specifically for Maryland, or is this all commingled with other states?
It would be from ratepayers in Maryland, and that
Okay.
$1 from each person is then segregated into an account that's applicable to this state. So we know that this money is from the state of Maryland and ratepayers in Maryland, and the only purpose is as previously stated.
Okay, so it's not like commingled from other states. It's all specifically Maryland and that. Okay, thank you. Thank you, Madam Chair.
Okay, we're holding that bill until tomorrow. So tomorrow, whenever we're off the floor, I'll give you enough time to grab some lunch and we'll be voting. So tomorrow's Wednesday and we'll vote Thursday and in between on Friday, so it's gonna be a busy week. And we're praying we're not gonna be here on Saturday. Senator, the next bill is Senate Bill 400 and it's David. And go ahead.
Okay, Senate Bill 400 is concerns prohibiting youth transportation companies from using various methods, including blindfolds, hoods, handcuffs, straitjackets, when transporting children to residential child care programs, which are defined. There's an additional amendment that probably should have been put. We have amendments from the House, and there's an additional amendment. So if you could hold this bill till tomorrow so we can get the extra amendment on there. It concerns Department of Human Services children.
Motion to hold.
Hold the bill.
Yeah. Okay. The next bill on your list is Senate Bill 431. This is an administration bill that does four things. It, amongst other things, but the main four things it does is it establishes a Maryland Office of Registered Apprenticeship Development in the Maryland Apprenticeship and Training Program for the purpose of developing apprenticeship programs throughout the state. It also establishes a Registered Apprenticeship Qualified Intermediary Program to bring in intermediaries into the state whose purpose is to link apprentices with sponsors. There is also a Maryland Apprenticeship Initiative Program and Fund. The initiative program is designed to provide subsidies to help folks start up apprenticeships in the state, and the fund is what is going to be used to fund these subsidies or incentives to develop apprenticeships in the state. The bill also repeals the Youth Apprenticeship Advisory Committee, which was established several years ago. The bill also has another requirement in there that falls under the Maryland Apprenticeship and Training Council that requires a 1-to-1 ratio for journey workers to apprentice. However, the Maryland Apprenticeship and Training Council may recommend a deviation for non-hazardous occupations and may consider formal requests for deviations from other occupations. You have a reprint in front of you with amendments from the governor. Some of the amendments are designed from the governor to address some of the concerns from the unions, including AFSCME and the AFL-CIO. You also have several amendments in the reprint from Senator Rosopep, who's very much involved with apprenticeship. If you go to page 2 and 3 of the reprint, there was a lot of the bills introduced also would require plumbers and various other occupations to waive exam requirements if the applicant for licensure completed an apprenticeship. That was largely not in favor of anybody in the labor or anybody with these occupations. So the governor has offered an amendment to strike all those provisions from the law. So there's nothing in here now about using an apprenticeship certificate to substitute for an exam to become a licensed professional in Maryland in these occupations. If you go to page 3 at the bottom, you'll see this is the language that starts the one-to-one apprenticeship journey person requirement. And on top of page 2, this continues on, allowing deviations from that the council may, there's a clarifying recommendation on line 3 where the council may recommend a deviation from the minimum ratio and also may consider formal written deviation requests from all other occupations. The department is maintaining a list of these has developed a list of these non-hazardous occupations, and some of these could be found in Senator Washington's bill from last year. At the bottom of the page, there's an amendment offered by the governor. There's an annual report required of the program about apprenticeships, and it changes preceding calendar year. The unions would prefer looking back 5 calendar years on the development of apprenticeships. If you go to the top of page 3, there's new language on this reporting requirement to reflect the changes or the additions of these programs to the Department of Labor. And then on line 10, you see that one of the programs, the Maryland Apprenticeship Incentive Program, that's going to be changed at the request of Senator Rosa Pepp to Maryland Pay Per Apprentice Program. And then there's new language under line 10. This is again from the governor, and this was offered by the AFL-CIO and AFSCME, requiring the outcomes of what happens to apprentices after they become employed. At the bottom of the page, the next 2 pages, this is where this is the language that repeals the Youth Apprenticeship Advisory Committee, which was established about 10 or 15 years ago. On page 7, this is the language that establishes the Maryland Office of Registered Apprenticeship Development. And the purposes of this office are on lines 7 and 8, and there's an amendment here. Again, this is offered by Senator Rosa Pepp. So instead of to market and advance registered apprenticeship systems throughout the state, it would scale registered apprenticeships across industries and occupations to meet the needs of Maryland's economy. On the bottom of the page, this is the language that establishes the Qualified Intermediary Program, and they're all identified here. The idea, again, the key component for an intermediary is connecting sponsors, employers, or potential, and there's a clarifying amendment there, apprenticeship program participants with registered apprenticeship programs. Those are lines 21 through 23. If you go to the next page, there are some additional amendments that are offered by the governor and Senator Rosa Pepp, which are mostly clarifying. Regarding the program reporting requirement for the intermediary program, it has to include a process for monitoring and evaluating the program. That's from the AFL-CIO and AFSCME. In the middle of the page, you'll see in consultation, that's changed to from collaboration to in consultation. And this is from Senator Rosa Pepp. And they're adding a new body here, the Registered Apprenticeship Development Advisory Board. That is from Senator Rosa Pepp. And you'll see later on in the bill that this advisory board is established. On the bottom, this language concerns the Maryland Apprenticeship Incentive Program. As you can see, at the request of Senator Rosa Pepp, it's going to be changed to the Maryland Pay for Apprentice Program Fund and Maryland Pay for Apprentice Program, and the governor has accepted all these amendments. On the next page, there's this technical or clarifying change or a technical change on lines 4, again reflecting the changing name of the program. The purposes of the program are spelled out after that on page 9, and that include helping employers and sponsors to offset their costs, including recruitment, education, training, and accommodating for disabilities or materials associated with hiring newly registered apprentices. And at the bottom, again, there's a technical change or corrective change because it's no longer the Maryland Apprenticeship Incentive Program, but rather the Pay for Apprentice Fund. On the next page, there's standard, on pages 10 of the reprint, there's standard special fund language. The bill came in with a mandated appropriation from fiscal years 2027 through 2030 of $5 million. There's an amendment offered here as to offset this mandated appropriation. Instead, it would say the governor may include in the annual budget bill an appropriation for the fund. At the bottom, there's, and on to the next page, there's a process for awarding grants from the fund. And then on page 11, on lines 5 through 8, you'll see there's a big change here, and most of these changes relate to retaining apprentices through the duration of their apprenticeship and completion of the apprenticeship. So they have to, anybody who receives a grant would have to attest to trying to retain apprentices through the duration and after completion unless they leave on their own accord or dismiss with cause. This is a governor's amendment, again, offered through the AFL-CIO. And as I mentioned before, there's Senator Rosapep offered language establishing this advisory board. The purpose of the advisory board is to advise the office on strategy to achieve its mission of expanding registered apprenticeship opportunities in the state. The members of the board are spelled out at the bottom, one member of the Senate, one member of the House. The terms are on the next unnumbered page. This is standard language that applies when you create an advisory board. It's going to be here forever. And then the duties of the board are specified on the unnumbered page in F, including consulting with the office and providing advice on programs operated by the office. And then there's a annual reporting requirement. The bottom of the page, there's a change to the standard special fund language. When you create a new special fund, you have to add it to the state finance and procurement article, so it makes a technical correction there. On the back of on the last page, page 12 of the amendment, there's instead of the Maryland Apprenticeship and Training Council, it should be the Maryland Department of Labor. That's a technical change. And then there's the staggering of the appointment of the newly created advisory board. That's standard language also.
You don't have all the little notes by all your amendments.
No, you don't. You couldn't read if I put that in, you would be able to read my writing.
Because it was very difficult.
Yeah, I'm spoiling all this.
Yes.
Yes, she has.
Yes.
I'd like to hold the bill.
Okay.
Please don't make David read all that again when it comes back.
I think I know why he's holding the bill. So.
Okay, that's fine. Thank you.
All right, we have a Senator Bowdler,
Peer-to-peer car sharing programs. David?
The next bill on your list is Senate Bill 771. And this, again, yes, it involves peer-to-peer car sharing. And if you can really summarize it in one sentence, it reverses who's the primary insured when you participate in a peer-to-peer car program. Under current law, it's the owner of the vehicle. This would make it to the driver of the vehicle. So specifically, the Senate Bill 771 makes changes to provisions of law governing car insurance, as I just mentioned, for peer-to-peer. The bill repeals the current law specifying which insurance coverage is primary when a vehicle is being used. There are provisions of current law repealed that prohibit an insurer from denying, canceling, voiding, terminating, or other actions regarding a claim on the basis that a motor vehicle covered by the policy has been available through peer-to-peer. Lastly, the bill authorizes part or all of the motor vehicle liability insurance covering a vehicle while it is being used for peer-to-peer car sharing to be provided by the individual driving the vehicle. There are also changes regarding accidents occurring in other states, transferring monetary liability and charging drivers for tolls, and that a peer-to-peer car sharing program is not liable for a citation issued through a traffic control monitoring system. There are no amendments and there's no opposition to the bill during the committee hearing.
Move favorable as amended.
you second, Senator Reed, is that what that means? All right, so we have Senator Collins, Senator Reed, all in favor of the unamended Senate Bill 771.
Oh, sorry, move favorable then.
All your bills are used to amendments.
Fair.
Last
Comcast amendment to it.
last bill of the day, David.
Last bill of the day is Senate Bill 872. This involves providing preferences for veterans and spouses of service members and veterans on tests offered for local government hiring. Currently, there are preferences in state government that give veterans and spouses of veterans so many points on a test they take for employment, and what the points do is allow you to move up a certain grade, a certain band, so you can get a preference. There's no absolute preference in state government, but there's these points you get on tests. In 2016, you passed a law that authorized private sector employees to offer these tests, but you needed to pass a law, and it has to be authorizing only, or else you could run afoul of certain EEO laws. So what this bill does is it adds local governments to the provisions of the labor and employment article that authorizes preferences for veterans and their spouses. You have an amendment offered by the sponsor of the bill, and instead of mandating that local governments offer this preference, it makes it authorizing for local governments. So that would be on page 3 of 4. And then there's just the new language in the local government that would guide that local governments can use if they choose to offer preferences on exams for employment to a spouse, an eligible spouse, or the veteran. And other than that, there are no other changes to the bill. So it's authorizing for local governments, but you need something in the law so as not to run afoul of certain EEO laws.
Well, I'm tempted to hold the bill, but I'll ask for a motion. Senator?
Yeah. Thank you, Madam Chair. So, David, so when you say authorizing, this is like, I'm thinking of another term, enabling is legislation.
Enabling them to do something they already can do.
We've heard that argument before.
It's enabling, okay.
Just saying. Nothing wrong with it, but.
Okay. Enabling them.
A few of those this year.
So, you go, David, I'm just kind of not clear with the terminologies that's being used.
It doesn't require local governments to enact any type of hiring preference for veterans, including points on a test. But it creates a framework in the local government article for them to do so, as long as, if they decide to go that route, they would have to follow the framework established in the local government for these preferences and who would be covered. Basically, it's who would be covered.
Okay.
Spouses and veterans and their spouses, or military spouses.
Okay, thank you. So Senator Gao said they can already do this.
Well, I'm sorry, except for certain counties, right?
Yeah, some of the smaller counties can't actually do this on their own. Some of the commission counties would usually require some sort of state authorization to do.
Yeah.
But this would, yeah.
So some counties can do, everyone can do it now.
Kensington
So-
pension, is
so-
there a problem? Like, what?
I'm trying to understand something.
The argument given it during the testimony on the bill is there's possibilities that you could run afoul of certain federal or state EEO program, mostly federal EEO laws.
If veterans receive this preference in their families?
For the private sector, you need some sort of state law to give cover for a private sector firm to offer some sort of preference to veterans.
Right. But this is for local government.
This is for local government, so the county executive testified that they would like this type of state law to give them cover so they don't run afoul of certain EEO laws if they offer a preference to veterans.
Yeah, well,
or their spouses.
I mean, I don't understand why it would run afoul of federal law when the federal government offers hiring preferences for different categories of veterans and spouses.
Mm-hmm.
So I'm not following that. When federal law allows it, and according to our attorney, Senator Guile, they can do it now.
I'm still supportive of the bill.
Okay, so it's like, I mean, it's like, but.
Castley thinks they need it. I tend to think Bob probably.
So you're saying, okay, so.
I think from the county executive's testimony, or at least something that I also was communicated to me by the bill sponsor, was that Hartford County's attorney had advised them that by having, I guess, the endorsement of state law, that it would help with any arguments that this is discriminatory in nature. And I do agree that there's probably not really an argument of a discrimination claim, but just for the abundance of caution, I think that they would prefer to have this. I would want to state, I do support this policy. So
okay.
That's what the testimony was.
Okay. Thank you. Thank you.
So what are we doing here?
Yeah.
Move favorably.
You got a motion. You got a second? On 872.
Did you second?
Sure, why not?
Yeah. Senator Hayes, Senator Reedy?
God bless.
Hayes and Reedy, all in favor of Senate Bill 872? Unanimous. Oh, are you all voting for 872? Senator Guile?
Yes.
All right.
Madam Chair.
Yeah, I did.
Unanimous.
That's it, huh?
That's it for today. It was much longer than I thought it would be.